Again, a huge number of people, but still moving things in the right direction. In West Virginia, opioid deaths declined by 46%. In Wisconsin, by 44%. Things were moving in the right direction. But President Trump appears to be doing everything in his power to reverse this progress with his characteristic recklessness and bravado. Just a few months ago, he slashed staffing at the Substance Abuse and Mental Health Services Administration by 50%. He terminated $1.7 billion in block grants for mental health services for state health departments, and he cut $350 million in addiction and overdose prevention funding in 2025. It's already way underfunded, but he's been slashing away at the money that's actually there. His one big ugly bill cut tens of billions of dollars out of Medicaid, which provides health coverage to nearly half of adults in America who have an opioid use disorder. But we're not going to be able to treat addiction to opioids in the crisis we have in overdoses by blowing up boats in the middle of the ocean. We've got to treat the people who are suffering from these addictions. Mr. Chair.
26,000 fewer Americans died of opioid overdoses in 2024 than in 2023. That is not a statistic. That is 26,000 people who went home to their families. It was the largest single-year reduction in opioid deaths in American history, driven by treatment funding, naloxone access, mental health services, and the infrastructure built specifically to address addiction as a medical emergency. The Trump administration has cut or eliminated the majority of that infrastructure in under a year. SAMHSA, the federal agency responsible for coordinating substance abuse services, had its staff slashed by 50%. The $1.7 billion in mental health block grants that states used to keep hospitals, clinics, and recovery programs running terminated. The $350 million in addiction and overdose prevention funding gone. And Medicaid, which covers nearly half of all American adults with opioid use disorder, is being cut in the Republican budget bill moving through Congress. Meanwhile, the administration is spending billions on military strikes in the Caribbean that have not intercepted a single fentanyl shipment because Venezuela does not produce fentanyl. The State Department confirmed this in its own 2025 report.
We've not stopped any fentanyl from coming to the United States, the drug primarily responsible for killing Americans, since Venezuela does not produce or export any substantial amount of fentanyl. They changed the subject and started talking about cocaine. These strikes fundamentally weaken our ability to bring cases against drug kingpins or the networks that actually sent these drugs, since we're blowing up the lower-level witnesses that we need in order to indict and prosecute higher-level operators.
The DEA's own fact sheet is unambiguous. Fentanyl is manufactured in foreign clandestine labs and smuggled into the United States primarily through Mexico, not Venezuela, not the Caribbean, Mexico. The Trump administration's September 2025 Truth Social post announcing the first strike said the boat was loaded up with mostly fentanyl. Factcheck.org traced that claim and found it contradicted by the State Department's own narcotics report. The administration has never walked back the claim. The strikes have continued, now at 47, against boats in a theater that has no meaningful connection to the fentanyl deaths killing Americans. The Organized Crime Drug Enforcement Task Forces, which coordinated the actual cross-border cartel investigations, operated for 40 years and produced 37,000 overseas investigations. That is where fentanyl supply chains get disrupted, through years of undercover work, confidential informants, and coordinated prosecutions that require witnesses to survive long enough to testify. The boat strikes are destroying those witnesses. The task forces that would use their testimony are gone. The agents who ran those investigations are now processing immigration paperwork.
And as I survey the wreckage of this administration's drug enforcement policy, I'm reminded of what Talleyrand said about Napoleon, who murdered one of his cousins. He said, "This is worse than a crime, it's a mistake." And so what has taken place with these lethal strikes on drug boats is both a crime murder, plain and simple, but it's also a mistake. The administration has not provided any plausible legal justification under domestic or international law for Trump to use the military to kill anyone that he unilaterally deems to be a terrorist. If these people were on U.S. soil, they would be arrested based on probable cause, if it existed. They'd be indicted. They'd be tried in court. And then they'd be convicted by a jury of their peers, or they'd be acquitted.
West Virginia saw a 46% drop in opioid deaths under the Biden administration. Wisconsin, 44%. These are not blue states posting favorable numbers. These are states at the epicenter of the opioid epidemic, seeing the most significant improvements in a generation through treatment access, not military operations. Those improvements required federal funding that is now being cut. Rural hospitals across these same states are on the front line of addiction treatment, and they are closing. The Medicaid cuts in the Republican budget bill are projected to eliminate coverage for millions of adults who rely on it for opioid treatment medications like buprenorphine and methadone. These are not abstract policy debates. These are the medications that keep people alive long enough to recover. The administration has a choice: fund treatment or fund explosions. It has chosen explosions in the wrong ocean, targeting the wrong drug supply, killing people who cannot be tried or named, while pardoning the connected traffickers who can be. The math of who lives and who dies under this policy is not complicated. It just requires looking at the numbers.
If they've committed crimes here, they should be prosecuted here, and they should be sentenced and fined here. The billions of dollars these unlawful and ineffective executions cost could be used to save American lives. We should fully restore mental health service funding. We could support rural hospitals that are on the front line of this addiction crisis. We could be investigating real drug traffickers and prosecuting more drug cases. But Secretary of War Hegseth needs his clicks, and so we continue bumbling down this reckless, inexplicable, and counterproductive path. It's not just a crime, it's a mistake. I yield back to you, Mr. Chairman.
Administration would rather not discuss. 26,000 Americans survived 2024 who would have died at 2023 rates. That progress was not an accident. It was the result of investment in treatment, in mental health services, in naloxone distribution, in the infrastructure that treats addiction as a medical emergency instead of a military target. That infrastructure is being dismantled while the military is bombing the Caribbean for content. The strikes have now killed 163 people. The administration will not release their names. It will not explain who they were or what evidence justified their execution. It operates under a classified legal memo no member of the public has been allowed to read. The UN has called for a halt. The ACLU is in federal court. International allies have withheld intelligence. And the Senate, bipartisan, including Republicans, tried to stop it, narrowly failed. Meanwhile, Juan Orlando Hernandez, 400 tons of cocaine, 45-year sentence, is free. Ross Ulbricht, 1.5 million drug transactions facilitated, is free. The men who moved the most cocaine in Western Hemisphere history walk out of American prisons while the administration calls anonymous boat operators narco-terrorists and fires the lawyers who say otherwise. Raskin said it plainly: this is not a war on drugs, it is a mistake. And the Americans dying of fentanyl in West Virginia and Wisconsin are paying for it with their lives while the administration films boat explosions. Share this. Subscribe. The people paying for this policy deserve to know what it actually costs.